Dr. J. Derek Teakin in League City. Maintaining the biggest part of maintaining your teeth is coming in regularly. It's kind of like your car. Like if you never go get your oil checked or you never have your oil changed or anything like that, your car's only going to last you for so long. Eventually, you're going to burn up the engine or something bad's going to happen. So, and if there's something that's going wrong, if you're going on a consistent basis, you're getting x-rays, you're getting good exams and everything else, not only are you getting your teeth clean and maintaining it, but if something does pop up, we're gonna address it early. We're gonna take care of it. Dentistry gets expensive kind of the longer, what may have needed a sealant turns into decay and a filling. And then a filling, if you don't take care of the decay when it's just a filling, eventually it gets to the nerve. Now it's a root canal and a crown. And then if you don't do it before then, the tooth may fall all to pieces, and now all of a sudden you lose the tooth, and now you're talking about an expensive implant to replace it. So same kind of thing as a car. Like just routine maintenance goes a long, long way. What happens during a routine dental appointment? It For us, we're different. Like we're looking at everything. We're looking at airway. We're looking at misalignment of teeth. We're looking at cosmetic options. We're looking at, whitening. We're looking at restoring teeth before they break. If we see cracks in the teeth, all of those things. We want to be proactive. We want to make sure that the goal is for you to basically have your own natural teeth your entire life. And we have a very thorough, very complete exam. We even get saliva tests to see what kind of bacteria is in there, where you may be more prone to having periodontal disease, things like that, even higher risk for decay, all of that. So we're very thorough. It's probably one of our biggest things is that we really do spend a whole lot of time in the first visit to get all of that information and give a patient, kind of what their best starting point is and how can we be preventative to make sure we take care of their teeth. So patients can be different. Some patients are just their chemical makeup. Maybe they're on medications where they have dry mouth. There's a lot of things that kind of can complicate. So to just say, hey, you should get your teeth cleaned every 6 months is not really a good option for everyone. There's some patients we see every 3 months. There's some we see every 4 months, or some that we see every 6 months. But that is individually, we decide individually any kind of problems they're having, if they have health issues, if they're on medications, all of those kind of things, diabetes, then even being pregnant, we want to see a pregnant woman even sooner to make sure they don't have any pregnancy gingivitis. It affects the birth weight of their baby. All of those things are huge. So it's not just an exact 6 months or 3 months or 4 months. Whatever's best for that patient is what we recommend. If you brush your teeth and your gums bleed, that means you're probably overdue for a cleaning. We always tell patients, like, if you brush your hair, does your hair follicles bleed? It's not normal. That's not a healthy thing. And they can look at their teeth too. Like you can, if you have a lot of tartar and calculus and stain and all of that, then certainly it's due. But if you're noticing bleeding, even more so, we want to see you for sure. Do routine cleanings prevent larger dental problems? Absolutely. No question whatsoever. It's not only does it prevent, but it also allows us to catch things when they're early. It's every time we can put our eyes on, whether it's an x-ray or a photo or visually looking in the mouth with a mirror, whatever that is, the key to, God forbid, even cancer. Like you catch cancer early, you have a much better success rate than later. So we want to catch anything that's going on in the mouth early. If someone in League City is ready to get scheduled for a cleaning or due for a cleaning, then I'd recommend reach out to Teakin Smiles Dentistry. It's real easy. Call the phone number 281-334-4944. We'll get them scheduled, or you can even go on to teakinsmiles.com and book an appointment. So we make it really easy.